What is fear of injections, or needle phobia? Fear of injections, or trypanophobia, is an intense and exaggerated form of fear that occurs when injecting serum or ampoule or even thinking about it. The phobia of ampoules may interfere with your health, because your health may be compromised by avoiding situations that bring about this fear. There are many solutions and techniques to reduce the effect of this fear, and it can be treated. What is clay from the ampoule? Fear of injections, trypanophobia or needle phobia, is a severe fear of needles and a phobia. In particular, people with a fear of injections in the hospital are afraid of injections in any form, such as ampoules or serum. They may avoid receiving vaccines, blood tests, etc. Although needle phobia is common, it can have severe consequences if it causes avoidance or delay in medical care. Ampoule phobia is closely related to phobia of needles or sharp objects. But people with trypanophobia are specifically afraid of needles in medical settings. Fear of injections is more common in children, and some people learn how to cope with needle phobia by the time they reach adulthood, but for some, the fear of vaccines stays with them into adulthood. Symptoms of ampoule phobia. The symptoms of trypanophobia may interfere with your life, and this interference may be so severe that it is difficult to bear them. These symptoms can be so severe that they are debilitating. Symptoms manifest themselves when you see needles or are told that you need to have an injection. If you have trypanophobia, it may cause you to fear receiving medical care, especially injections. When you have an injection, you will likely experience high blood pressure and a high heart rate in the hours and days leading up to it. When it happens, your blood pressure may drop rapidly and you may even faint. The important symptoms of ampoule phobia are dizziness or even fainting, sleeplessness or insomnia in the days or even weeks before the injection, nausea, temporary high blood pressure in the hours near or during the injection, sweat, high heart rate, feelings of fear and anxiety, panic attack, avoiding or running away from the situation. In some cases, you may feel angry, trembling, caused by fear. Diagnosis of ampoule phobia. Based on the diagnostic criteria of the American Psychiatric Association (APA) and DSM-5, you will be diagnosed if, based on the information, the specialist determines that your fear of injections is a phobia. If you have severe fear or anxiety when seeing a needle or needing an injection, the psychologist will ask you questions such as the following. How long have you experienced the fear of injections? Exactly what symptoms do you experience when you see a needle? How long do your symptoms last? Is your fear of shots making it difficult to get the medical care you need? Is your fear of the situation irrational and exaggerated? Does your fear lead to leaving the situation or extreme anxiety? Your symptoms must have been present for at least 6 months and not due to another disorder. Why off forever? The reason for the fear of the injection. There is no single, proven cause for a phobia, and you may not even know why you have a phobia. But if you have a question, why am I afraid of the injection? It is commonly believed that a phobia can stem from a traumatic or unpleasant incident in your childhood. Researchers have found that pinprick fainting and trypanophobia are sometimes familial and hereditary. Different people may fear certain aspects of needles or injections. We mentioned some of the reasons that may cause the fear of injections. Previous unpleasant experiences with needles and syringes. Negative experiences involving needles or medical procedures may contribute to the onset of syringe phobia or needle phobia. For example, in a period of your life, you had a chronic and annoying disease for which you had to use needles and serum repeatedly, or once you experienced a painful and non-standard injection due to the inexperience of the injector or other reasons. Hyperalgesia. Genetics and family history. Fear of vaccines appears to be inherited, as an estimated 80% of adults with the condition have a first-degree relative who suffers from the same phobia. Unpleasant information and experiences of others. For example, someone around you tells a very unpleasant and unusual story about injection or serum injection, and you believe that injection is always as terrible. Evolutionary fear. Some evolutionary psychologists believe that fear may have roots in human survival in ancient times. Needle stick wounds can be fatal in the past, especially in the days before modern antibiotics. It is possible that the fear of piercing the skin is an evolutionary adaptation. The difference between fear of injection and phobia of injection. It is important to know that anyone who is afraid of needles does not have amphiphobia or trypanophobia. Fears and phobias are different. Almost everyone is afraid and uncomfortable about getting injections and blood tests. But when can you say that a person has trypanophobia or ampulphobia? To answer this question, you need to know the difference between fear and phobia. Fear of injections. Fear is something that every person experiences. It's completely normal to feel anxious about certain things, especially when it comes to needles and serums and blood tests. Ampulphobia. Phobia is associated with severe anxiety and even anxiety disorders, which show themselves with much more intense feelings and emotions than fear. Fears often have a logical and understandable reason. For example, you are afraid of the pain caused by injections and needles. But a phobia is when a person has much more intense and exaggerated feelings about a situation or object. Like the fear of a dental injection for anesthesia, which is not only harmful, but also beneficial because it is supposed to prevent you from suffering. Treatment of ampulphobia. Like the causes of injection phobia, the ways to deal with the fear of injection can be both physical and psychological. For example, psychotherapy, cognitive behavioral therapy, and exposure therapy can all be useful in treating phobias. There are also skills and techniques that can minimize this problem for you. Trypanophobia is also included in the category of phobias, and phobia treatment techniques in general can be used to deal with it. These treatments may be drug or non-drug. It is better to consult a good psychiatrist to choose the best treatment approach. In the following, we mention the techniques and methods of treating the fear of injections. Exposure therapy for fear of injections. Exposure therapy means that in this type of treatment, you are gradually confronted with your fear and phobia. A therapist may show you pictures of a needle, ask you to stand near a needle, or ask you to hold the needle. In this way, it helps you to gradually change your physical and mental reaction to the needle and become less intense. Cognitive behavioral therapy for fear of injections. Cognitive behavioral therapy, CBT, is used to treat a variety of phobias. This treatment involves talking about your fear with the best psychologist in the field. You learn new coping techniques and different and new attitudes about needles. Cognitive behavioral therapy can help you gain more control over the symptoms of needle phobia or head fear. Meditation. To reduce your anxiety and worry during the injection, meditation techniques and calm tone can help you to overcome the fear of serum or injection in the hospital more easily. This will make this experience less painful for you, and you will be able to deal with it little by little. For more information on how to meditate, you can see the benefits of meditation or what are meditation. How to meditate. C. Drug treatment of fear of injections. In cases where a person has a lot of stress that cannot be solved by psychotherapy, we may need to think.